What are the long-term effects of a hip flexor strain? Have you ever wondered what happens when an athlete suffers a hip flexor strain? This common injury can have lasting effects if not treated properly. Let's break it down. A hip flexor strain occurs when the muscles that help lift your knee and bend at the hip, mainly the iliopsoas muscle group, are overstretched or torn. Athletes and active individuals are often at risk, but even those with sedentary lifestyles can experience this injury. The severity of the strain plays a big role in recovery time. Mild strains may heal in just a few weeks, while severe strains can take several months to rehabilitate fully. One of the long-term effects of a hip flexor strain is chronic pain and discomfort. If the injury is severe or rehabilitation is not completed, ongoing pain in the front of the hip or groin area can persist. This pain can limit an athlete's ability to perform at their best and interfere with daily activities. Another effect is reduced range of motion and flexibility. After a hip flexor strain, scar tissue can form, leading to stiffness and decreased mobility. This limitation can affect crucial movements in sports, such as sprinting, kicking, or quickly changing direction. Muscle weakness and imbalance are also common after a hip flexor strain. If the injury is prolonged or heals improperly, the hip flexor muscles can weaken. Compensatory movement patterns may develop, causing imbalances with surrounding muscles, like the glutes. This imbalance can affect pelvic stability and increase the risk of other injuries, including lower back pain. Additionally, there is an increased risk of re-injury and related hip problems. Athletes with a history of hip flexor strain are more likely to experience recurrent strains or other hip conditions, such as tendinopathy or bursitis. Over time, these issues can lead to degenerative changes or even requiring surgical intervention. Finally, persistent hip issues can impact athletic performance and career longevity. Chronic hip problems can reduce an athlete's performance level, limiting playing time and opportunities for advancement. In some cases, these issues may even lead to early retirement from competitive sports. For those pursuing careers in athletic training, managing hip flexor strains effectively is essential. Early and accurate diagnosis, along with a structured rehabilitation program, can promote full recovery. This program should focus on gradual stretching, strengthening, and sport-specific training to reduce downtime. Prevention is also key. Strategies like proper warm-ups, maintaining hip and core strength, and avoiding prolonged sitting can help sustain athletic performance and career progression. Understanding the long-term effects of a hip flexor strain is vital for athletes and sports professionals alike. With appropriate care and attention, many of these effects can be managed or even prevented, allowing athletes to maintain their health and performance over time.